Tonight, while you sleep, your body will run a test you never signed up for. For millions of people, the airway at the back of the throat will close. Not once, but 5, 15, 30 times an hour. Each time oxygen falls, the brain jolts half awake, and blood pressure surges. And here is the strangest part. In population surveys, roughly 9 in 10 people with clinically significant sleep apnea had never been diagnosed. It is called obstructive sleep apnea, and it is one of the most common conditions a heart doctor will ever see. Stay with me and you will know the signs by the end, the ones a bed partner hears, and the ones you feel by day. And you will know exactly what to ask your doctor for. The request has a name, a sleep study. That is the whole ask. This is the episode we promised at the end of the last one. Chapter 1. The Night Surge. To understand what sleep apnea does to a heart, you have to watch one single event, about 30 seconds inside the body. It starts in the throat. When you fall into deep sleep, every muscle in your body relaxes, including the ones that hold your airway open. In most people, it stays open anyway. But if the airway is narrow or the tissue is heavy, relaxation is enough. The walls slacken, draw inward, and close. Apnea is Greek for without breath. Air stops, but the heart does not, and the body keeps burning the oxygen it has. So the oxygen level in your blood starts to fall. 2%, 4%, sometimes far more. The monitor knows. Nothing else in the house does. Falling oxygen trips an alarm in the brainstem. It does not wake you, not fully. It rouses you just enough to fire the throat muscles, snap the airway open, and pull in air. If someone is beside you, this is the moment they hear. The silence breaks with a gasp. Here is where the heart pays. That alarm is not gentle. It is a full sympathetic surge, the same system that fires when you are startled. Stress hormones spike. Blood vessels clamp down. In one small physiology study, blood pressure at the end of these events reached as high as 240/130 in some subjects. Your cardiovascular system is doing crisis work, flat on its back, at 3 in the morning. Now repeat that. An event every other minute is 30 an hour. Doctors count them. 5 to 15 an hour is called mild. 15 to 30, moderate. Above 30, severe. Some people spend half the night in this loop and wake up with no memory of any of it. Blood pressure is supposed to fall at night, your cardiovascular system's only scheduled rest. In sleep apnea, that dip can flatten out. In the Wisconsin cohort, people with more than 15 events an hour had over 4 times the odds of losing their nighttime dip, which means the one part of the day your arteries expect to spend off-duty is exactly when the surges keep coming. Chapter 2, What the Night Does to the Day. Researchers in Wisconsin followed hundreds of adults for 4 years and simply counted who developed high blood pressure. People who started with more than 15 events an hour had nearly 3 times the odds, 2.89, compared to people with none. And the risk climbed step by step with every tier in between. That is a dose-response association. The risk rising with the dose, and it is why researchers treat this as a serious risk factor, not a coincidence. Flip it around and the picture is starker. 30 to 50% of people with high blood pressure have sleep apnea alongside it. And among people whose pressure stays high, despite multiple medications, what doctors call resistant hypertension, up to 80% may have it. Most of them do not know. Same disease hiding inside another diagnosis. The heart's rhythm feels it too. In a Mayo Clinic cardiology cohort, 49% of patients with atrial fibrillation, the most common serious rhythm disorder, screened positive for sleep apnea versus 32% of other cardiology patients. After adjustment, roughly double the odds. An association measured with a screening questionnaire, but a loud one. Zoom all the way out. The American Heart Association's scientific statement puts sleep apnea prevalence as high as 40 to 80% across 6 conditions: hypertension, heart failure, coronary artery disease, pulmonary hypertension, atrial fibrillation, stroke, and in the same breath, it calls the condition under-recognized and undertreated. This is not a niche sleep complaint, it is cardiology. Chapter 3. The Signs. Here's the problem with everything I just told you. It happens while you are unconscious. You cannot feel your own oxygen fall. So the signs split into two lists, the ones somebody else hears and the ones you carry into the day. List 1 lives in the bedroom. Loud, frequent snoring, not the occasional rumble, but most nights. Then the more telling sound? Silence. Snoring that stops, holds its breath, and breaks with a gasp or a choking sound. If someone has ever told you that you stop breathing in your sleep, that sentence is data. Take it seriously. The pattern is the whole tell. Steady snoring is the airway vibrating, narrowed but open. The silence is the apnea, the airway sealed. The gasp is the rescue, the brain's alarm doing its job. Snore, silence, gasp. If that loop sounds familiar, remember it. It is the sentence to say to a doctor. List 2 follows you out of bed. Waking unrefreshed from a full night. Morning headaches. Sleepiness that leans on you all day, dozing at your desk, in meetings, at red lights. A fuse that got shorter. Focus that got harder. And a detail people rarely connect, waking up 2-3 times a night to urinate. One more thing about who this happens to. The stereotype is an older, heavier man who snores loudly. The stereotype misses millions. In women, the condition is diagnosed even less. In one Wisconsin estimate, 93% of women with moderate to severe sleep apnea had never been diagnosed. And it often wears a different costume. Fatigue, morning headaches, insomnia, more than loud snoring. The condition does not check whether you fit the profile. So let me be careful because this list is not a diagnosis. Snoring alone is common and mostly harmless. Being tired has 100 causes. What earns a conversation with a doctor is the cluster. The pattern at night, plus the exhaustion by day, plus especially anything on the next list. Chapter 4, The Conversation. The American Heart Association names the people who should be screened even without classic symptoms. Blood pressure that stays high on multiple medications, pulmonary hypertension, and atrial fibrillation that keeps coming back after treatment. If you live in one of those sentences, the question is not whether to ask, it is why nobody asked sooner. And the ask itself is one sentence. I think I might stop breathing in my sleep. Can we look into a sleep study? A sleep study just measures what this episode described. Airflow, oxygen, effort, rhythm, all night. Some are done in a lab. Many now happen in your own bed with a small home kit. It is measurement, not treatment. Nobody is committing you to anything. What happens if they find it? That part is genuinely good news. Sleep apnea is one of the most identifiable and treatable risks in cardiology. Effective options exist, and choosing among them is exactly the conversation to have with your doctor, not with a video. What matters tonight is simpler. The condition cannot be treated while it is invisible. If you want proof of how seriously cardiology now takes this, in 2022, the American Heart Association added sleep to its official checklist of heart health, Life's Essential 8. Blood pressure, cholesterol, blood sugar, activity, diet, weight, smoking, and 7 to 9 hours of sleep. And buried in the scoring is a detail made for this episode. Untreated sleep apnea can cost you 20 points. Sleep did not make the list as a luxury, it made it as a vital sign. So here is the whole episode in one breath. At night, the airway closes, oxygen falls, the brain fires, pressure surges, on repeat. Over years, higher odds of hypertension, of stubborn hypertension, of a heart that loses its rhythm. The tell is the pattern, snore, silence, gasp, plus the daytime exhaustion. And the move is one sentence to one doctor about one night of measurement. And if you share a bed with someone, tonight you are each other's monitor. If they have ever said you stop breathing, believe them. If you hear it in them, tell them. It is strange, unglamorous data. It is also the kind that gets people to a diagnosis years earlier. If this was useful, the next one continues the theme of small inputs with outsized returns. What happens to your blood sugar when you take a short walk after eating? And why 5 minutes beats an hour at the wrong time? Subscribe so you do not miss it. This episode is education, not medical advice. Every statistic you saw is an association from these cited studies, not a guaranteed personal outcome. Check with your doctor before acting on anything here, especially if you recognized yourself in Chapter 3. Sleep well. Measure once.